Health campaigners say they are becoming increasingly concerned about the pressure on the accident and emergency unit at Gloucestershire Royal Hospital after seeing ITV News pictures of 16 ambulances queuing outside. The pictures were filmed early on Tuesday evening and the hospital insists the safety of patients wasn't compromised. Ken Goodwin reports.
There were 16 ambulances queuing at Gloucestershire Royal Hospital when we filmed on Tuesday evening. The scenes have shocked campaigners who want the neighbouring town of Cheltenham's A&E to reopen to ambulances as soon as possible. It was temporarily closed for blue light emergencies at the onset of COVID as a safety measure. The organisation REACH is campaigning to have A&E services restored to Cheltenham, which they say would also reduce the pressure on Gloucester's hospital.
We have the evidence in front of our eyes. This is the third time in 3 weeks we've been out here, Ken. Ambulances queuing up out of the block, and 8 miles down the road there's a perfectly functioning hospital which should be open. They've promised that they're going to open the hospital. Pull your fingers out, boys, and get that hospital open.
Martin Horwood, Cheltenham's former MP and now a Liberal Democrat councillor, says the strain being caused by the changes is there for all to see.
This is really alarming and it has the makings of a perfect storm. If you've got crises like this at Gloucester A&E and you've got COVID doubling every week in this country, this is panning out to be a very, very worrying situation as winter approaches. And really, management at the Trust ought to be focused on this and not on launching reorganisations to centralise even more services at Gloucester.
In a statement, Professor Mark Pietroni, the Hospital Trust's medical director, says, "On occasions when ambulances arrive in quick succession, we experience queues, as was the case on Tuesday. Importantly, through existing processes to manage surges in ambulance arrivals, swift action was taken, and this was addressed within the hour. Patients are always assessed by senior clinicians on arrival and triaged accordingly to ensure that anyone who has had to wait for assessment is subsequently seen according to their clinical priority." But campaigners worry the combined effects of COVID, winter flu and bad weather, if it comes, could prove too much for just one hospital to cope with, even with the most diligent planning. Ken Goodwin, ITV News, Gloucester.